introductions and then opening the floor to our presenters. So to quickly introduce myself, I'm based at the Johns Hopkins Center for Communication Programs, or CCP, where I'm Communications Director for the USAID-supported Knowledge for Health, or K for Health project. And prior to joining CCP, I was at APCO Worldwide, a global PR agency, where I led communications campaigns for corporate and nonprofit healthcare clients. My co-moderator today is Lippy Doshi. Lippy is a communications officer for digital advocacy at PATH, based in Washington, D.C. She leads PATH's institutional social media, as well as the digital communications for PATH's advocacy and policy work. Lippy and I are co-chairs of Social Media for Global Health, an online community of nearly 800 professionals from over 45 countries. And if you're not already a member, I encourage you to join us. And for those of our members who are joining, welcome. We have a great active network, and members use our listserv to learn, share experiences, and ask for help promoting important health and development resources. Our two presenters today are from Action Sprout, a company that helps nonprofits build more and deeper relationships both on and off Facebook. Drew Bernard is Action Sprout's CEO and co-founder. He's a tireless advocate for the planet and the people working to make it a healthier, more just, and joyful place, and has been helping organizations build productive relationships with supporters online since the early 2000s. Sarah Francis, head of training at Action Sprout, is also joining us today as a presenter. And Sarah's superpower is using technology to get millions of people incredibly excited to help organizations succeed. At Action Sprout, she trains and coaches teams to do exactly that. Before joining Action Sprout, Sarah was the Chief Technology Officer at Moms Rising, a million-member advocacy organization focused on making America a truly family-friendly place. And in just 5 short years, Sarah helped build Moms Rising from an organization of 20,000 to an organization that is over 1 million strong. Before I turn it over to Drew and Sarah, just a bit of housekeeping. This webinar will last for approximately an hour. My colleague Lindsay Mitchum will be moderating our chat box. If you have questions for Sarah and Drew, please type them into the chat box as you follow along. Lindsay will be collecting them for the Q&A period following the presentations. And we hope to answer as many questions as time allows. And if you haven't introduced yourself in the chat box, please do so now. Finally, this webinar is being recorded and will be posted to K4Health's website later this week. And with that, over to you, Drew and Sarah.
Thank you. So I'm Drew Bernard. Let's see here. I'm going to, I guess, forward to the next slide here. So I'm Drew Bernard, and with us as well. Thanks everybody for giving us a bit of time to talk with you all about Facebook data. So I believe many of you, or at least some of you, were in a session recently where Sarah talked about Facebook overall sort of content strategy and just generally about Facebook. Today we're going to shift gears and we're going to talk about work that we've been doing over the last year, really year and a half, talking about how to actually tap not just Facebook as a platform for powering campaigns and for engaging people and reaching people, but also tapping Facebook for data to inform campaigns, to inform campaign strategy, and to inform campaign creative. So I'm going to, I'm walking, the deck that I'm going through today, oops, I guess I can't use the down arrow there, let's go this way. Yeah, so this is us, we've already been introduced. Typically during sessions like this we do them in person, and there's lots of opportunity for people to raise their hands and ask questions. So I apologize if I go too fast. Please do write questions in the chat area, and we'll get back to things at the end since this is kind of a one-way stream today. So this number is, some of you may have seen something like this, and I think all of you have felt it to some degree or another. But you know, since from the beginning of time to about 2003, there was about 5 billion gigabytes of data created. Today, that happens about every 10 minutes. And what we're going to talk about today is a piece of that 5 billion gigabytes that's being produced every 10 minutes. I'd say, I wouldn't say a small piece of it, but a piece of it, and how organizations can be tapping into that to inform their campaigns. So we think of this work that we do here as sort of looking for insights, tapping into Facebook data for insights in order to have impact, to improve the performance and the effectiveness, the efficiency of campaigns. We're doing a lot of work in the global health sector, so we'll be thinking and talking about this from the perspective of sort of social change types of work today. So, oops, looks like my slide is the wrong shape here, so I'm going to explain what this says. So I'm going to be talking specifically today about Facebook data. And it's really important when we talk about any kind of data, it's really important to understand the sort of the context of the data in order to understand its value. So the first thing I want to talk about is I want to talk a little bit about why this data exists and why people, why people are doing things on Facebook that result in data being created. And because that has a huge impact on what the data is and how we can use it. An example that I give is if you think about Google, it's really easy to understand the sort of the intent of the user when they're on Google doing a search. They're looking for something. Their intent is to get some information that they want, either for themselves or maybe for someone else. But the intent is they type something in and they're asking Google to do something, and their intent is to get information on that specific topic. Well, on Facebook, when people do things that result in data being captured, their intent is very different. And why, and at the end of the day, it really comes down to people engaging with content on Facebook. And so we have to understand why people are engaging and sharing content on Facebook to really understand what this data can tell us and what it can be really used for. So I want you to stop and think. I'm assuming most of you do to some degree use Facebook or have used Facebook. So I want you to think about your own use for a second. And think to yourself, have you ever clicked the share button because you thought that the content you were sharing may be of value to one of your friends? Maybe you thought that it was interesting information that your friends would appreciate. Maybe you thought that it was something that would make them laugh, something that would give them joy and that they would appreciate. Or maybe it included information that you thought was really important for them to understand to help protect themselves or take care of themselves. The second reason, or the second question is, have you ever shared something because you thought sharing it could make a difference? An article that you thought many people could see, a piece of content that you thought was particularly valuable, and you just believed that more people in the world needed to see it, and so you clicked share to share out with your network of friends. And finally, thinking about your own activity, really in any social channel, have you ever shared something because you want people to know something about yourself? Because you want to show, when I was a kid, my dad used to always say, "Show me, don't tell me." When I would say, "But Dad," and he'd say, "Show me, don't tell me." And really, that is another kind of core reason that people share content. So think about your own use. Are these things that are things that you do? Well, it turns out that these are the top 3 reasons. Whoops. I think we just lost. Oh, it's coming back. So these are the top 3 reasons that people share content on Facebook. And it's really, really, I think you probably heard about this a little bit last week with Sarah. It's really important to understand and think about this when we think about what value we can get from the insights we can glean. What kind of insights can we glean? What kind of data are we pulling from in order to understand how we can use that to inform campaigns? So these are the top 3 reasons that people share content. And anyone who was in the last session probably have seen this. Number 1 is because we think it will be useful to our friends. Number 2 is because it helps define who we are. It's how we define our social selves these days, is what we engage with, what we share. And then finally, to have an impact. So these are the top 3 reasons that people share content on Facebook. And that's going to come up. Well, as we go through, you'll understand a little bit more about why is that so particularly valuable and important, and why is this data so unique that's coming from Facebook. So what we're doing is we're really tapping into the Facebook data in order to identify insights about audiences, about who's engaging with content or with topics, how they're engaging with it, what people are saying about it, what they're not saying about it, who's not engaging with it, those types of things, to understand both the audience that we're talking to, but also to get a better idea and understanding of how people are thinking about those given topics. And it all boils down to, of course, getting the right information to the right audiences at the right time. And in the case of global health, that means improving lives or even saving lives. So one of the ways that we're doing this these days is through a tool that Action Sprout has been building and continues to build, called Topic Insights. And what Topic Insights does is it taps into an application programming interface, an API from Facebook called Audience Insights, that allows us to, I wish I could see the next slide, but I'm going to go ahead and go forward. I'm afraid I can't remember how granular we got on this slide deck. But what it allows us to do is it allows us to pop into Facebook and essentially sort of monitor conversations within a given country, within a given region, to hear who's talking about certain things. And the way we do this is we literally think about the words. What are the words that we want to listen for? And I'll show you an example of one of these at the end of my slide deck here. But we jump in and we try to understand what it is we're listening for. So if you think about a survey or a focus group, when you go into a focus group or a survey, you have an audience in mind, maybe. You have the topic that you want to understand, so maybe you craft some discussion questions or some specific questions. In this case, what we do is we identify the keywords that we want to monitor for. So this particular spreadsheet that we're looking at was from a study that we did looking at the conversation that was happening in Peru during a really horrendous natural disaster related to flooding. And our goal for this particular campaign, or this particular study, was to understand how people are talking about and thinking about different things. So for instance, we wanted to understand, hey, what are the needs that people are talking about most? Are people talking about shelter? Are they talking about water? Are they talking about rescue? What are the different terms people might be using to identify and be talking about the needs that they have? Another was related to disease. Are there particular diseases that are spiking in terms of conversation and that people are most concerned about? And importantly, that people are sharing content with their friends related to. So what Topic Insights does, we come in, we define the topics that we want to monitor and learn from, and then we begin to run what we call a study that then goes out and it talks to Facebook, and Facebook begins to send back, I'm going to say data, but in a lot of ways what they're sending back is insights about that data. So let's say, for instance, that, and the example I'll show at the end, and actually this slide shows some data from, the first time we ever used this data was for a project down in Brazil related to Zika. And actually, I think this was the first time this data from Facebook was ever used anywhere, was to help inform a campaign to get people to take action related to mosquitoes. So it was about vector control, how do we get people to take this, to take action, to take this situation serious, to take action to protect themselves from Zika. So we ran a study looking at terms that related to Zika. And then what happens is the API then begins to kind of create two buckets of information that we can tap into. One bucket of information is related to the topic itself. Here are the top content that people are sharing. So I'm going to stop there and talk a little bit more about what I mean by that. So one of the things we're getting is here's the top content that people are sharing on Facebook. And what that means, if we think back to the earlier in the slide deck, is this is the content that people believe their community needs, right? These are the articles, these are the pieces of content that people either want their friends to have because they want them to, they're wanting to get it to them to help protect themselves, or they're wanting to spread it because they think everybody needs to see it, or they're sharing it because it says something about themselves, which might be the case in, well, actually, in many cases, I'm sharing this because I want you to know I'm a caring person and that I care about you. But anyway, so on the content side, we get those types of things. On the other side, we get a whole bunch of information about the audiences. Now, this is all de-identified, anonymized, aggregated data, so we're never looking at an individual we're looking at the whole group. So let's say, there could be 1 million people, and this gives us some insights into what does that audience that is engaging with this look like. And we'll show an example of this in a minute. So we then tap in and we start looking at all of these different possible ways of sort of analyzing this audience and thinking about the content that they're sharing. And again, I'll show you an example so we'll get more into detail in a bit. But from there, we then take those insights, and in the case of the Zika project, one of the key insights that we pulled from this, and actually I'll hold that for later. But anyway, so we then run data-informed campaigns. And what I mean by a data-informed campaign is I mean, who are we targeting? Who's the audience that is engaging with this today? Are we missing certain audiences? Those types of things. And then the other side of that is who's spreading this information and why? What are the characteristics of the information that is spreading the most, and how can we tap into that? So again, the first time we used this was in Brazil in 2016 during one of the rainy seasons around the Zika outbreak. And in that particular case, what we were looking for is we were trying to understand, again, who's talking about Zika, what content is most being shared, what content do people think has the most value. So we spun up a study, and we began to monitor for these conversations. And then we popped in, and again, we're not predefining the audience, we're not predefining questions. We're literally saying, hey, and when people talk about Zika, who are they, right? Who is it that's actually talking about it? Who's sharing content related to it? And what are they sharing? So one of the first things that jumped out at us from this, that jumped out at UNICEF, when I say us, in this case we were working with UNICEF Brazil. So the first thing that just completely jumped out at the UNICEF Brazil team was that men were highly active in this conversation. And in fact, their target audience early on, I don't know if you can see my mouse, but when they had done focus groups and surveys, all of their focus groups and surveys had focused on women, 18 to 34, sort of the childbearing age. That was the audience they thought was most important to this campaign. And what they found was that actually men were way more engaged. In fact, at one point, and this ran for months, at one point I think it was something like 52% of the conversation. In this particular graph, we're seeing 52% women. At different times, it would actually be more men talking about Zika than women. So the other thing that they noticed very quickly was that actually this audience, this younger audience that they really care about, was really was not very engaged with the conversation. And this particular graph, what this is the actual people that are engaging with the topic. And then back here, the gray is sort of the sort of average Facebook user. So if you were to, this is sort of what they call under-indexing. So young women are under-indexing in this conversation relative to other conversations on Facebook. So they're very much not engaging with this particular conversation. But the other thing that noticed is that, gosh, you know what? The older women are way more engaged. Now, these may be actually the moms of the young women saying, hey, this is important, and actually sharing content with their daughters or their friends, their young friends, to help protect them, from Zika. And the same thing's happening on the male side. So this was one of the first things completely surprised the UNICEF team, was to see how many men were engaged. The other thing that we were able to pop in and see is kind of where the conversation is happening. Where's the bulk of the conversation? Now, this wasn't super surprising. We could very much see that the conversation was happening where, and by the way, I don't think this image is from this campaign, so this is not really representative. This was just an image. But the conversation was happening where the outbreak was the worst. Other things we were able to pop in and see is things like relationship status. Who's really engaging with this? And what kind of, what's the marital status of people most active, the education level, and some stuff around device use. Now, for the most part, on Facebook, the vast majority of Facebook use is on mobile device. So we're not super surprised when we see mobile-only use being high. In fact, this is actually lower than many countries. But in this case, 86% on mobile. But what is interesting is Android versus iPhone use and how much it's over-indexing. Now, you can kind of read that however you want, but often what that means is that, iPhones are a more expensive, sort of bleeding edge kind of device we often see. So when we see more Android use, it means that there's a sort of a wider economic spread of the, whoops, I just went backward, of the audience that we're talking to. And then also, what kind of work do these people do? So one of the things that popped out to us as we were looking at this was that there was a high percentage of the conversation happening amongst sort of white-collar people who either had or have held more sort of white-collar oriented jobs. But we were really missing, this conversation was not really reaching people in more of the blue-collar types of jobs. And then again, this is the sort of blue-collar job being missed. So who's not actually being reached? Who's not engaging with this conversation? And we saw earlier that it was younger women were way under engaging, which was very disheartening. But we also see, sort of the makeup of what does this audience look like that's not quite as engaged. The other thing that we get about the audience side is we get to understand who or what entities, what organizations, what political folks, what kind of magazines, what are the types of pages, what are the types of organizations that this audience that is engaging with the conversation is most active with. So, and I think I may, not sure, yeah, so this is an example. I'll go back over here. So now we're, both Sarah and I are from the West Coast of the United States. We don't speak, well, my brain is Portuguese. We don't speak Portuguese, and we certainly don't know any, most if not any of these pages and entities that these audiences are most engaging with on Facebook. So when we popped in here with the UNICEF team, they quickly kind of went through here and they were looking for different things. And what jumped out at them really quickly were two names. You can think of these as influencers, the people that are, these are the pages and the organizations and the entities that this audience is most engaged with. You can kind of think of these as influencers. So the two that really jumped out at them were these two gentlemen. One is Dr. Drazio, who is a sort of a national doctor. He's sort of a well-known medical figure in Brazil. And then the other is Luciano Huck, who's is some sort of a TV personality. Both of these were highly engaged, or the audience that was engaging with the Zika conversation were sort of over-indexing as engaging with these people. So they would be really great spokespeople. So one of the things they did is they then went out and they shared content from Dr. Drazio about Zika, let him be the spokesperson. I don't know if they ever ended up doing anything with Luciano Huck, but but you get the idea there of kind of, he would be a very good spokesperson. I think they may have had him post something out through his Facebook page at one point during the campaign. So that's the audience side, understanding who the audience is. The other thing we get to dig into is, what about the content? What are the users actually sharing? What content are people thinking that their friends should be most engaged with? And the way I think about, and really we have some really great data to show this, the reason people are sharing global health information or public health information is typically because they want to help their friends. They're sharing it, I think of it as kind of they're sharing because they care. And so understanding what kind of content is being shared is really valuable to understanding what people are thinking. They're kind of putting their stamp of approval on it when they share it. And it's important to note, actually, let me back up. There's another important piece here. A question that comes up oftentimes is around, sort of myths and misinformation being shared. And certainly myths and misinformation are shared, but no one is sharing myths or misinformation on Facebook to dupe their friends, right? And I think this is super important to think about as practitioners in the health space, is people are sharing information on Facebook because they actually believe it has value. They believe that their friends lives will be made better, whether that just means it's funny or if it means it could save their lives. They're sharing content not because they think it's myths. When they do share myths, and we've seen some really great examples of this, when we see content that's really being shared often on Facebook and it's super obvious myths, when you dig into it, what you find is that people are sharing it with lots of comments saying, this is ridiculous. And so they're actually sharing it to tamp it down and say, don't believe this, is what we ought. Or, and in the case of Zika, there was a lot of confusion about Zika. People weren't sure. So some of the information we were seeing was people literally thinking, well, maybe this is this, or whatever. And those are really valuable insights to see. Are people sharing this because they believe it, or are they sharing it because they actually are trying to dispel these rumors or misinformation? So when we dig into the data on the topic side, one of the most interesting things that we get to tap into is the context that this conversation is happening around, right? So what are what we call co-occurring topics? So when someone is talking about Zika, what else are they talking about? So one of the things, if you look at this very quickly, what we saw was, and actually this was taken partway through this data itself was pulled partway through probably a month in or 3 weeks in. But throughout the process, what we saw was chikungunya was co-occurring a lot. So when content that performed very well on Facebook, that people were sharing, all of those types of things, it often talked about chikungunya. Well, and it of course talked about Brazil. This was taken around the time of the Olympics, so there was a lot of conversation about Olympics happening. But we also, and then there's some things around the mosquito. The other thing that was showing up at different times were other mosquito-borne illnesses. So anyway, I'll keep going here. I'll talk a little bit about what that means. So this is another sort of view of that data from another time. So in this case, dengue was the top co-occurring topic, and chikungunya was second. So I'll tell you a little story about this. Kind of keep this in mind, and I'll tell you a little story about this at the end of this. But so we get to see those co-occurring topics, and we get to start thinking about what's going on. What is it that's making people think this content is something that is worth sharing with my friends and helping spread and engaging with and becoming part of? So when someone shares a piece of content on Facebook, that content is sort of becoming part of them, right? They're kind of putting their stamp of approval. It's becoming, they're putting their voice behind it. So the other thing we get to look at is what is actual top performing posts? What is the content that's really performing well? And so these are a couple of examples. This particular article is talking about how you distinguish the difference between dengue, chikungunya, and Zika. This was far and away the most shared piece of content. And what was interesting about this was you can see in this that, this is literally going head on, talking about multiple illnesses. And in fact, Zika is over here on the right. It's not even the most prominent. One of the things we kind of theorized very early on was that actually people were less likely to share content that just talked about Zika than they were content that also talked about chikungunya, dengue, even yellow fever. And yet, and at the same time, the quality of the content when it included these other things was much better. The recommendations, the suggestions, the information was actually very, very high quality when it talked about multiple diseases. And at the time, this was so new that the UNICEF team was like, we don't do campaigns where we talk about things other than the particular disease. We're not working on dengue, we're not working on chikungunya, and we don't want to dilute the message. And so they didn't use this piece of insight. And I would actually argue this was probably the strongest signal that was pulled from the data, was that we should really be talking about not just Zika, but other mosquito-borne illnesses if our goal is to get people to take action. So about, probably 4 or 5 weeks, or months, I guess maybe it was like 3 months later, or whenever the next cycle was coming back around for for Zika, UNICEF went back out and did focus groups and surveys, armed with these insights. And at the time, during this campaign we were running, they were focused just on young women, and all of the messaging was related to Zika. So after going back out for the next round with some of these insights, they came back from that process of surveying and focus grouping, and their entire strategy shifted to talking about multiple diseases and also including other audiences. So even the focus group survey data kind of confirmed what we were pulling from Facebook about a week in, quite a few months before that second set of surveys and focus groups. So this particular campaign, what ran only for, I don't know, maybe 3 or 4 weeks, and our goal was to just see, does data-informed content work? Can we improve the performance of content by better understanding the audience, by better understanding the conversation that's happening around this topic? And so, long story short, the answer was a great success. The UNICEF team was extremely happy. We saw people who people who were exposed to the content that was this data-informed content had a 3% higher likelihood of stating that they intended to take action to protect themselves from Zika, which was, to me, I mean, to be honest, like when I see a 3% jump, I was like, 3%? And they were like, oh my gosh, this is huge. So it was very effective for them in this particular case. And we've now used this same approach, the same kind of data in other places and in other ways, and are seeing similar types of results. So being able to better understand the audience, better understand the topic, has really had a huge impact in a number of instances. And this is just a bit of a case study that you can kind of walk through and show some of the results. So I think that is the end of my deck. Let me just check my time. Yep, look at that. Sarah, I think you should be very proud of me. Under by 20 seconds.
Awesome. So Drew showed everyone one source of data, and that's topic insights. And he walked through the data we pulled from the Topic Insights API from Facebook, and how you can use those insights to inform creative on Facebook to actually have a measurable impact on the conversation and improve public health in general. I'm now showing you a tool that is inside Facebook right now. Anyone can access it as long as you have a Facebook account, and we'll make sure that Lippy and Anne have that link so that you can go and play around with it. And I think Audience Insights is a tool where you can learn both about who is on your Facebook page and also just do research in general before you start any campaign to learn about your audience and really build a sense of who this audience is. You go into Audience Insights, and right now we're looking at everyone on Facebook. So we're going to pick a location. So when I think about a campaign that I'm going to run, let's say I want to run a campaign around childcare in the United States to inform young mothers, kind of change the conversation nationally about how expensive childcare is, and really build an engaged audience. So what I'm going to, and I have to find out about this audience who's looking for childcare in the U.S. to kind of think about what type of creative and what type of communication may work best with this audience. So you can put any country or city, or country or city is primarily the two locations you can filter by. You can't get more granular than city.
And while she's doing so, this tool, Audience Insights, just to give you some context, this tool really exists for advertisers. It exists to help you do two things. One is create a targeted audience. So in the case that Sarah's laying out here, she may actually want to create an audience of young moms, or she may want, and I would say, or she may want to look at an audience and both create an audience, but also get a bunch of information about them, again, to better understand the audience, to inform the campaign itself, to inform creative, those types of things, based on more the demographic versus the conversation. So what we looked at before was, these are people talking about these things, and what Sarah's showing you here is information about people that is sort of based on their activity on Facebook and some of the demographic information about them.
So I picked the United States up here, and it's really important when you're filtering to make sure that when you're done filtering and you want to look at something else that you X out any filters. I've been caught actually doing the United States and another country. So make sure you know how to use these filters. Then you can pick any age. So right now I'm interested in looking for this example. I want to find people who have young children, who may be my audience around childcare. So I'm going to say all genders, and I'm not going to limit it by age because I'm going to come in here into the advanced, and you can come here to parents, and then you can either do all parents, expecting parents.
Hey, Sarah, can you move your mic a little closer to your mouth? You're a little quiet for folks.
Sure. All right, so I'm going to do all expectant parents and children 0 to 3. So the gray bar are people on Facebook in the United States of America. So this is kind of your benchmark in the country that you're looking at. The blue bar is the audience that you're choosing by these filters. And I want to make sure that you understand where this data is coming from. The age and gender is all self-reported data. So that's what you put in when you fill out your Facebook profile. But when we dig in more to the data, you'll see that some of it is observed behavior. So here we can see the breakdown. About a lot more women than men, so 61% women. So in this campaign, we're going to be talking primarily to women. And we're going to be talking primarily to women ages 25 to 34. In the US, if you're doing research in the US, you can see lifestyle data. And this is combined, they're pulling in data from Axiom. You can't see this lifestyle data in any other country. So just for a quick reference, and you can see all the information and the definitions about Axiom data if you click this link right here. Then you can see the relationship status. Again, this is self-reported data. So we're talking primarily to married women. Look at how much it's overperforming compared to the rest of Facebook in the United States. Educated, most of them are in college. A lot of them, 24% of them, have only graduated high school, but still it's about 19% less than Facebook as a whole in the United States. You can learn also about their job titles and really build a picture of who you are going to talk to for this campaign. And you can also dig in a little bit more and see page likes. And this is where it gets really interesting. So as soon as my computer loads, in the top categories is observed behavior. So it's looking at what types of content your audience is gravitated towards. So here you'll see, and this is what Drew was talking about when he was looking at the data in the topic insights. So you can see what types of categories your audience really gravitates towards. Who is the news that they're turning to? Who are the public figures that they're turning to? And you can find potential campaign partners here. We have the Pioneer Woman. She's a big blogger. You can see who you may want to have as a partner with this. And then you can also see the page likes. And you can learn about what this audience does on Facebook. So what type of device they use Facebook, whether or not they use it from a mobile device, or whether or not they do it only on their desktop, and where they are, in what types of cities they're in, and where they are across the country, and what they do on Facebook, whether or not they like pages, whether or not they follow ads, whether or not they share posts. This is a really active audience on Facebook. They click a lot of ads. They share a lot of posts, more than Facebook as a whole. And we know that we are building content primarily for a mobile audience. 54% of this population, of this audience, has only logged on to Facebook using a mobile device, and most of them use an iPhone or an iPod. So that is Facebook Audience Insights. You can also do it by interest. So not just demographic behavior, so age and parents, you can also look at their interests, whether or not you are running a campaign that is around nutrition or around vaccinations or around health and wellness. And all these interests are observed behaviors. Whether or not you have an audience that is interested in, they like a lot of images of children or babies, or like a lot of images around the environmental issues, anything like that, you can limit it also by interest. You can really dig in and do a lot of research about the audience you are building a campaign for. We'll make sure you guys have this link so you can explore it after this webinar. All right, LYFTies, so I'm done showing off audience insights. I think we can open it up for questions.
Thanks so much, Sarah. Sorry about interrupting earlier. Every time you show me this tool, I'm really blown away, and I'm sure many of the participants that are tuning in today are feeling the same thing. I just want to kick off with a thank you to both of you for the insightful presentation and really explaining how Facebook data can make campaigns more strategic and also can improve the performance of content. And it seems like we have two groups of questions. And so some are around how the data works, and then some are about the Zika case study. So maybe we'll just start with the data itself. The number one question I'm getting is, how do we access this data?
So there's two answers to that, depending on the two things that we showed you. The tool that Sarah showed you is something that you guys all have access to. I'll warn you, we'll send you a link. I'll warn you a little bit that it's a little convoluted to get into. If you have any problems, honestly, email me or email Sarah. I just put together a little screen capture recently showing, walking through the process of getting it working, but I kind of look at it as, if you're running any kind of campaign, if you're thinking about any issue in any country and you want to even think at all about an audience, you really should pop in and take a look at it. So it's a little bit, I think of it as kind of like it's an engineered tool, so it's not super well easy to use and get into, but once you're in there, you can start poking around. It's not hard to use once you're into it. So that one it's up on Facebook now. We'll send out the link, or we'll make sure that Ann has the link and you all get that. If you have any problems, just email us and we'll create a little recorded screen capture thing that shows you how to do it. The other tool, the Topic Insights tool, is one that's a little harder. That one is only currently available on projects that we're working on, that Action Sprout is working on. If it's something that you think might be interesting, again, drop us a note. We're working with Johns Hopkins using this. We're actually working with USAID and Gates and Facebook and others to leverage that. So if you have a campaign that you think would be really interesting to use sort of data-informed stuff on, data on, then let me know and we can help on that. If there was a particular campaign or a particular area of focus, topics that a bunch of organizations wanted to dig into, then what we like to do is we try to do, when we're using the Topic Insight stuff, we really like to have networks of organizations so that it maximizes the use of that data. So if there was a collection of organizations all working on something together, that could be something that could be really interesting. But you can drop us a note on that one as well.
Thanks, Drew, and everyone's contact information on this presentation is listed at the beginning slide, and we'll of course share a recording of this presentation afterwards via the K4Health YouTube. So just making sure that everyone knows that there is a way to continue this conversation specifically about the tools. So some questions about the Zika case study. I think a lot of people are really interested about some of the data inferences that you shared, Drew. One question is about how the information was thought to be more relevant to women, but males ended up being more engaged with the content. One question from a participant was, males tend to own and use mobile phones more than women. Is that possibly why they were more engaged?
Yeah, so in that particular case, if you remember back to that graph, there was the gray bar behind the blue bar on women. The gray bar represents a sort of an average conversation on Facebook. And the blue bar was this topic. And if we go back on that slide, you'll see that actually men are what we call over-indexing, meaning men were talking more about Zika than they were talking about other things. And the same thing is going on the young women's side. Young women were talking about this less than their average conversation. So in this case, no, that wasn't the bias at all. It literally, they just were not as engaged. UNICEF's reasoning or theory behind that was they were hearing from a lot of young women that they were tired of the topic. They were getting bombarded with information about it, and they were kind of tired of it. And it, it was kind of one of those just big bummer conversations, and so they were not participating as much, I think, is part of it. But it was not actually a device bias on that. They just were not as engaged.
Really interesting. And sorry about the lag in between answer and question. I'm just making sure to mute my microphone so there isn't any feedback. The related question, when you look at demographics in this data, are we also accounting for other platforms that age groups might be using instead of Facebook? For example, is it possible that Brazilians from 18 to 29 might be on another platform like Tumblr or Instagram? And is there any way for this data to tell us that?
In the not distant future, I think it's very possible that we may be seeing data from Instagram also influencing, kind of flowing into this. Other platforms, not really. And the data that we were pulling for in Brazil was just Facebook. I will say, though, back to my early parts of my slides, I think it's really important. So I won't get into this too much, but it's important again to think about why people engage with and share content on different platforms, and it is a little bit different even across even in Instagram. From my opinion, I think the reason people share content in Instagram is maybe a little different than what they do on Facebook. So I think that when we look at some of the other, Tumblr's really interesting in other ways, but just the volume is just so much lower than what we're seeing within Facebook. If we went into into that audience insights tool Sarah pulled up, we could look at the data, but the number of people in Brazil that are on Facebook is just so darn high that that we sort of, we probably could have pulled more information, but we sort of didn't need to be blunt about it.
Got it, and I'm sure that would be a similar case for many other countries. Another question I got is, how were the post-campaign surveys and polling done?
That's a good question. So the way they were done, Facebook has a tool that they call LYFT Studies, and what they're designed for is to measure the impact or the efficacy of ads generally. And the way these work is we create an audience. So we define who the audience is that we want to reach. And in this particular case, I can't remember the total number, but it was like, 3 or 4 million people. And then what happens is we create a holdout audience of let's say 10% of that audience. And then at the end of the campaign, or actually as the campaign is going on, people are beginning to get little questions that Facebook pops up in the app asking for input, and people can answer those questions. So there might be 3 or 4 questions. You might only see one, so one individual may only ever see one of these LYFT study questions, but people answer the question and move on. And so it's kind of an in-app, Facebook-generated thing. So at the end of this campaign, what we did is because we carved it out, because it worked, we then, at the end of the campaign, we wanted to make sure that the people who had not been exposed, that 300,000 or however many, that they also had an opportunity to be exposed because it worked. We wanted to make sure everybody saw it. So in that case, Facebook ran a LYFT study. We looked at the data, and then we continued to boost the content out to the rest of the audience who hadn't been exposed to it before. But long story short, we use a thing called LYFT Studies. They're available. You have to reach a certain number of people, so there has to be significant ad dollars behind it. I say that we didn't. I think we spent a total of like $8,000 or something in Brazil. Typically, a LYFT study, it's a lot of work for Facebook to run these. So usually you would have to spend a lot more on ads. So it's not something that's super readily available to use, but we do get to use them from time to time.
Got it. Thank you. This question is actually for me. I thought the data point about Android versus iPhone use was really interesting, especially the inference that it may determine socioeconomic level. Are there other data points or data inferences that are unusual like that may not be obvious to social media leads that are on this call?
There are tons of them, and I will say, I mean, I think by location, those things are different, right? So seeing Android over iPhone usage doesn't necessarily mean that. In our particular case, we saw that, and then we also happened to see that, again, who was engaging with it was more white collar. You can also, in some cases, in some countries, and as Sarah was saying, not all of the data so Facebook pulls some of this data in from third parties. That audience insights tool, I mean, the value of the data that they're serving up there for free to everyone is just staggering. And it always amazes me how few people are really tapping into it. But anyway, so we were able to see, sometimes you're actually able to see even sort of like income levels of a given audience, kind of average income levels. But in that particular case, I think it jumped out at us, as really kind of like confirming as much as anything else. There's so many data points. There's so many things that you can poke in and look at, and some of them you look at and you go, there's just nothing here. I don't. What am I seeing here? There's both sort of an art and a science. The best way that I've thought about what we do with this data is it's not so much. This is not a big data problem, right? So when Sarah or myself or Katie or anyone on our team pops in to look at this information, this data, our job is much more about sort of discovering, sort of investigating than it is big data, right? We're not dealing with, millions and millions of posts. Facebook takes care of all that. They grab all that. They process it using lots of machine learning and other things. What we're doing then is going in and looking for like the interesting, like, what does that mean? Why is that the case? What are the interesting edge cases? What's going on there? And then by poking around, yes, that's sort of the art of it. Unfortunately, I mean, I wish we could say, yes, here's the list of them, but it really varies. Every country, every issue, every topic, every audience, different things kind of pop out.
Why it's so important to have an on-the-ground expert. One of the things about using Facebook in Brazil is that in Brazil, Facebook is the communications channel. There's Facebook and there's WhatsApp. Barely people use Instagram and Twitter. So we really use that on-the-ground information and then the audience insights data and then the topic insights data so that we could have a sense of benchmark. So we could see actually what's overperforming and what's underperforming.
And we have to have someone that is also an expert. I kind of glossed over this on that little spreadsheet slide where we're looking at the topics. Sarah nor I are experts in these issue areas. And again, we don't even speak Portuguese. So, we have to have an expert who's working with us to identify those terms when we're doing a term rule.
That makes sense. I was wondering the same thing because it looks like the data comes in the language that it's posted in. So it seems like you need a language expert, and then it also seems like you need a topic area expert to make some of the inferences.
Totally.
And you also need an expert that is able to take off their professional hat and pick words that are actually the words that people use on Facebook. So slang, not scientific words, right? So we don't use terms like urine, you use pee, right? Or how we actually speak in real life. And that's really important when we're crafting these studies.
Good point. That is something that I think communicators in health are often struggle with, and I see one more place where we have to work on that. So that's a really strong point. We are at time, so I think we should end questions. But it looks like there are quite a few. So once again, I'll reiterate that please feel free to reach out to Anne, myself, Drew, and Sarah with any further questions. I think this was a really interesting conversation. There's a lot to learn here. It's also great to know that so much of this data is available, and I think that implications for this data are massive. I think it could be really helpful in a humanitarian situation. Of course, definitely for a health situation. It showed the value of data in real time, that something can, in the case of the Zika case study, that we could react to a health crisis in real time. I think that's really powerful. So overall, I just want to say thank you. I also want to remind participants that if you're not already part of the Social Media for Global Health group, please do register. The link is on the first slide. We do conversations like this frequently. We also have in-person meetings, and we're a great listserv to share resources. And yep, that's it. So on behalf of Anne and I, thank you so much. Thank you, Drew and Sarah, again for this wonderful presentation and your time. We hope everyone enjoyed the talk and look forward to next time.